This week I was assigned renal artery stenosis. It's the narrowing of one or more arteries that carry blood to your kidneys or renal arteries. Narrowing of the arteries prevents normal amounts of oxygen-rich blood from reaching your kidneys. They need adequate blood flow to help filter waste products and remove excess fluids. Reduced blood flow may increase blood pressure in your whole body and injure kidney tissue. So the signs and symptoms include most people with RAS have no signs and symptoms until the condition reaches an advanced state. The condition is sometimes discovered accidentally during testing for some other reason. You may suspect a problem if you have high blood pressure, and if it begins suddenly or worsens without explanation, or if you have high blood pressure that begins before age 30 or after age 50. As it progresses, other signs and symptoms may include high blood pressure that's difficult to treat, presence of a bruit over your kidneys, elevated protein levels in the urine or other signs of abnormal kidney function, worsening kidney function during treatment for high blood pressure, fluid overload and swelling, and treatment-resistant heart failure. The cause of RAS, there's two main causes for it. So atherosclerosis of the renal arteries is the buildup of fats, cholesterol, and other substances in and on your artery walls. As they deposit and get larger, they can harden and reduce blood flow, causing scarring of the kidney. Eventually narrowing the artery can result. Most cases of renal artery stenosis occur because of this. The second most common reason is fibromuscular dysplasia. In this, the muscle in the artery wall grows abnormally. So the renal artery can have narrow sections alternating with wider sections, giving a bead-like appearance in imaging of the artery. It can narrow so much that the kidney doesn't receive enough blood and become damaged. This can happen in one or both kidneys. It is still unknown what causes fibromuscular dysplasia, but the condition is more common in women and may be something that presents at birth. And then I added a side note that rarely RAS results from other conditions such as vasculitis, neurofibromatosis, or a growth that develops in your abdomen and presses on your kidneys' arteries. So risk factors include, aside from atherosclerosis, aging, hypertension, hyperlipidemia, diabetes, obesity, smoking, family history of early heart disease, and lack of exercise or sedentary lifestyle. Complications include hypertension, kidney failure that requires dialysis or transplant, fluid retention, and shortness of breath due to pulmonary edema. Treatment for RAS may involve lifestyle changes, medication, or procedure. This really depends on the overall health of the patient and their symptoms. Sometimes all that is required is observation. For lifestyle changes, you would have to maintain or lose weight if you're at an overweight status, eating healthy foods, limiting salt in your diet, reducing stress levels, drinking alcohol or caffeine in moderation, if not at all, and not smoking. For medication treatment, hypertension is, even when mainly related to renal artery stenosis, can usually be treated with medication. ACE inhibitors, angiotensin II receptor blockers, diuretics, beta blockers, and calcium channel blockers are used to treat hypertension. If atherosclerosis is the underlying cause of the RAS, then you may be prescribed aspirin and a cholesterol-lowering medication. And then for the procedures aspect, for some people with uncontrolled high blood pressure and a complication such as pulmonary edema or worsening kidney function, a procedure may be recommended to restore blood flow through the renal artery and improve flow to the kidney. Procedures for this include renal angioplasty and stenting. In this, the doctors open wider the narrowed renal artery and place a device inside your blood vessel that holds the walls of the vessel open and allows for better blood flow. And then renal artery bypass surgery. During bypass procedure, doctors graft a substitute blood vessel to the renal artery to make a new route for the blood to reach your kidneys. Sometimes this means connecting the renal artery to a vessel from somewhere else, such as the liver or spleen.